I'm with Jim, who has diabetes and also has heart disease, had a blood clot in his lung at one point in time.
Bilateral, a bunch of them. Yeah.
And we put you on a new diabetic medication that pees out sugar in the urine.
Seems to.
What'd you notice?
I noticed minimal side effects, which was good. A little bit of constipation and thirst. I become thirsty, so I'm drinking a lot more water because I have a desire for it. Otherwise, I would say that I feel less shortness of breath and just generally better. I think I feel better.
Now, we never made a diagnosis of congestive heart failure.
No.
But in retrospect, you're feeling less short of breath and you can lie flat in bed.
Better, yes. I was starting to have a problem where I was waking up and having a shortness of breath. And I know that all my dad's brothers died of that exact same thing, but they didn't come to a doctor first. They were stubborn, they didn't go, and they all passed away from exactly the same thing. So I recognized the symptoms of it, and when you gave me that, that's why I accepted that medication, because I wanted to see what would happen. And what basically happened is a bunch of water came out of me, and continues to. Like, I'm up 3 times a night.
And you lost about, it's like 5 pounds.
About 5 pounds, I think, and I think that's going to continue as well.
You know, I'm always hungry. I'm always trying to eat less, join the human race.
Yeah.
But one of the things what I learned is that when I first started practice medicine over 30 years ago, diabetes caused heart attacks and strokes. Now, because we treat heart disease, and the best way to treat a heart attack with diabetes is to lower cholesterol.
Yes.
The best way now is that because of our treatments, because we do things like more bypasses and angioplasties, we're more attuned to this, is that now heart failure, congestive heart failure, is the leading cause of how people with sugar diabetes will pass away.
Right, I agree. I've seen things about that sort of thing.
And now we have used therapies that are better for
Yeah. Now, I did develop a little bit of a yeast infection at first. And after I had one bout of it, and then about a month later, another little bout. I know how to deal with it.
How are you dealing with it?
An antifungal cream. And it's on my genitals. So anyways, I don't know if it's because I was suddenly peeing all the sugar out, or I don't know what happened, but it definitely started. And I haven't had any trouble with it now this month, and that's good. You know, and I'm just watching it.
Good hygiene is important.
Yes, which I do have excellent hygiene at all times, but just a day or two of an antifungal cream, I don't know why it happened, but it just did. And I recognize it because I've had it before,
right? Okay.
Sort of thing. So,
you know, it's interesting when we start this conversation, you said to me, is that I think I might have had congestive heart failure.
Starting.
And we didn't appreciate that, and now we have a good therapy for you. It's working.
I like it. I don't know if I could handle a stronger medicine. I don't want to take a stronger one. And I've noticed myself with my diabetes at home, even though I've actually reduced some of my insulin. And I am going to see Dr. Rebecca Douglas in like 3 or 4 days. And she deals with and I think she's going to be quite surprised, is that my sugars have taken a downward turn, even though I've taken a little less insulin.
Do you have any kidney problems?
That was a question I was going to have, because I know they said to me before when they were looking at the other medication that my kidneys were okay, but just at the border of being okay to take this medication. I seem to be having, like, for me, I get back pain because I lift things, I do things, I tow, you know, and so, but I have had a little back pain.
Okay. All right, well, thank you for sharing that.
Oh, my pleasure.